Bismillahirrahmanirrahim. Today we are going to study the differences between the permanent teeth and deciduous teeth. You can see that this is the permanent tooth, the maxillary central incisor, and this is the deciduous tooth, maxillary deciduous central incisor. You can see that the size of this tooth is smaller and the permanent tooth is larger in size. This size disparity is for both the exists for both the crown and root portion of the tooth. The crown is also smaller in size and the root is also smaller in size. You can see that the crown portion of the deciduous teeth is very short in size cervically. Relative to its total crown plus root length. The crown is shorter relative to crown plus root length. When compared to the permanent tooth, the crown contribute to considerable portion of the root plus crown length. You can see that the crowns of the deciduous teeth are wider mesiodistally relative to their incisogingival or incisocervical height. When you compare them with permanent teeth, here the incisocervical height is more than the mesiodistal width. Also, you can see in posterior teeth, the mesiodistal width is more than the occlusocervical height. Also, you can see here that mesiodistal width is more, and this deciduous mandibular first molar and occlusocervical height is less, whereas in mandibular posterior teeth, permanent teeth, the occlusocervical height is comparatively more as compared to that of the deciduous teeth. The crowns of the deciduous teeth are more constricted faciolingually at the cervical line. They are more constricted. Here there is constriction. Whereas in permanent teeth, there is no such constriction faciolingually. Here, this is the deciduous maxillary first molar. Here you can also see constriction facialingually. Here and here there is constriction at the cervical line. The occlusal table of the posterior tooth is more constricted facialingually or buccolingually than that of the permanent teeth. This is the permanent maxillary first molar. So this occlusal table is more constricted facialingually. The reason for this is there is a greater occlusal convergence of buccal and lingual surfaces, whereas in posterior permanent maxillary teeth or mandibular teeth there is no such constriction. There is a cervical ridge on the anterior tooth on both labial and lingual surfaces in anterior teeth, whereas in permanent anterior teeth there is no such cervical ridge on labial and lingual surface. In deciduous posterior teeth molars, the cervical ridge is only present on the buccal surface. In comparison to the crown height occlusocervically, the root lengths are considerably longer in deciduous teeth when you compare them with the permanent teeth. Here the crown portion contributes significantly to the crown plus root length. So in deciduous teeth, the roots are relatively longer because of greater contribution of the roots towards the crown plus root length. The roots of permanent teeth are slender and thinner. They are ribbon-like. When you compare it with the roots of the permanent teeth roots are thicker. That's why we usually do not do root canal treatment in the deciduous teeth, and we usually do pulpotomies, the removal of cornal portion of the pulp because of chance of fracture of the remers in the deciduous teeth roots. They are ribbon-like, slender, and very difficult to do root canal treatment in the deciduous teeth roots. The roots of deciduous teeth are more spreading or flared. This spreading or flaring is because you have to give space for the premolars to erupt. These are the premolars. They have to accommodate themselves here in order to resolve the roots and erupt in, instead of the molars. You can see there that in permanent tooth there is an identifiable root trunk. Root trunk is that portion of the root located between the cervical line and the point of furcation. Whereas in deciduous teeth there is no identifiable root trunk. The deciduous teeth are lighter in color or milkish white in color. The permanent teeth are darker in color or yellowish white in color. So these were some of the differences between the um, permanent teeth and deciduous teeth. When you consider them from internal anatomy point of view, the deciduous teeth has thinner enamel, thinner dentine, but the pulp cavity of the deciduous teeth is larger, whereas the permanent teeth have thicker enamel, thicker dentine, but the pulp cavity is considerably smaller when you compare them with the deciduous teeth. So these were the some of the differences between the permanent and the deciduous teeth.